Ever felt an intense wave of fear or anxiety that seems to come out of nowhere, leaving you breathless and overwhelmed? You might have experienced a panic attack, but have you ever wondered what's actually going on inside your brain during one of these episodes? Today, we're diving deep into the science behind panic attacks to uncover what happens in your brain when panic strikes. A panic attack is a sudden episode of intense fear or anxiety that reaches its peak within minutes. It can cause a range of symptoms, including a racing heart, shortness of breath, sweating, trembling, and dizziness. While these symptoms can be alarming, they are part of your brain's natural response to what it perceives as a threat. When a panic attack hits, several key areas of your brain are involved in the process. Here's a breakdown of what happens in your brain during a panic attack. The fear center. The amygdala is a small, almond-shaped cluster of neurons located deep in the brain. It plays a crucial role in processing emotions, especially fear. When the amygdala detects a potential threat, it sends distress signals to other parts of the brain, triggering a stress response. During a panic attack, the amygdala becomes highly activated even if there's no real danger. This heightened activity can cause overwhelming feelings of fear and anxiety, contributing to the physical symptoms you experience. The stress regulator. The hypothalamus is responsible for regulating various bodily functions, including the stress response. When the amygdala signals a threat, the hypothalamus activates the sympathetic nervous system. This system prepares your body to respond to danger by increasing heart rate, blood pressure, and breathing rate. In a panic attack, the hypothalamus goes into overdrive, causing your body to react as if it's facing a real threat. This activation can lead to the physical symptoms associated with panic attacks, such as rapid heartbeat and shallow breathing. The rational thinker. The prefrontal cortex is the part of the brain responsible for higher-order thinking, decision-making, and problem-solving. It helps you assess situations and make rational decisions based on evidence and reasoning. When you're calm, the prefrontal cortex helps you manage and evaluate your fears. During a panic attack, the intense activity in the amygdala can overwhelm the prefrontal cortex, making it difficult to think clearly or rationally. This disconnect can exacerbate feelings of fear and make it harder to calm down during an attack. The memory center. The hippocampus is involved in forming and retrieving memories, including those related to fear and anxiety. When a panic attack occurs, the hippocampus may become activated as it recalls past experiences or memories associated with fear. This activation can create a feedback loop where past fears and anxieties resurface, adding to the intensity of the current panic attack. If you've had previous panic attacks, your hippocampus might become hypersensitive, increasing the likelihood of future episodes. The brain's response during a panic attack triggers a range of physical symptoms. Here's how these symptoms manifest. Increased heart rate. The release of adrenaline prepares your body for a fight-or-flight response, causing your heart to beat faster. Rapid breathing. Your body needs more oxygen to deal with the perceived threat, leading to faster and shallower breathing. Sweating and trembling. These are part of the body's stress response, helping to cool you down and prepare you to react. Dizziness or lightheadedness. Changes in blood flow and rapid breathing can lead to feelings of dizziness or faintness. Chest pain. Increased heart rate and muscle tension can cause discomfort in the chest, which can be alarming. Panic attacks can be triggered by various factors. Understanding these triggers can help in managing and preventing them. Genetic factors. Panic attacks can run in families. If you have a family history of anxiety disorders, you might be more prone to experiencing panic attacks yourself. Brain chemistry. Imbalances in brain chemicals, such as serotonin and norepinephrine, can contribute to anxiety and panic attacks. These imbalances affect how your brain processes fear and stress. Stress and trauma. High levels of stress, trauma, or significant life changes can trigger panic attacks. The brain may become more sensitive to stressors, leading to an increased likelihood of panic episodes. Health conditions. Certain medical conditions, such as thyroid disorders or heart issues, can mimic or trigger panic attacks. It's important to consult with a healthcare provider to rule out any underlying health issues. Understanding what happens in your brain during a panic attack is the first step toward managing and treating them. Here are some strategies that can help. Practice relaxation techniques. Techniques like deep breathing, progressive muscle relaxation, and mindfulness can help calm the brain and body during a panic attack. These practices can reduce amygdala activity and activate the body's relaxation response. Cognitive behavioral therapy, CBT, helps you identify and change negative thought patterns and behaviors associated with panic attacks. By addressing irrational fears and learning coping strategies, CBT can help you manage and reduce panic attacks. Medication. In some cases, medication may be prescribed to help manage panic attacks. Antidepressants and anti-anxiety medications can help regulate brain chemistry and reduce the frequency and severity of attacks. Always consult with a healthcare provider to determine the best treatment plan for you. Lifestyle changes. Healthy lifestyle choices can also help reduce the risk of panic attacks. Regular exercise, a balanced diet, adequate sleep, and stress management techniques can support overall mental health and reduce anxiety levels. Seek professional help. If panic attacks are affecting your daily life, consider seeking help from a mental health professional. They can provide guidance, support, and treatment options tailored to your specific needs. Panic attacks can be intense and frightening, but understanding what happens in your brain during these episodes can provide valuable insights into managing and treating them. By recognizing the roles of the amygdala, hypothalamus, prefrontal cortex, and hippocampus, you can better understand why panic attacks occur and how to address them. With the right strategies and support, you can learn to manage panic attacks and improve your overall well-being. Remember, you're not alone in this journey, and there are resources available to help you find relief and regain control.